Hi, I'm Katie, and you're watching the OCD Illustrated channel. This is the first video in a series about exposure and response prevention, a highly effective treatment for OCD. So let's jump in. This video will answer two of the most basic questions about exposure and response prevention. What is it? And why should you do it? Exposure and response prevention is a specific form of cognitive behavioral therapy, or CBT, in which a person gradually faces their fears without doing compulsions. The point of this is to habituate or get used to situations that previously caused discomfort. Future videos in this series will give you more detailed information about exposure and response prevention. For now, let's move on to our second question. So, why should you do ERP? In short, because it works. The International Obsessive Compulsive Disorder Foundation, which you can visit at www.iocdf.org, recommends CBT, specifically exposure and response prevention, as the gold standard treatment for obsessive compulsive disorder. And I'm a bit of a nerd, so I took a gander through Google Scholar to find some studies. One in 2005 found that exposure and response prevention, or exposure and response prevention plus medication, was better than medication alone. Another study in 2008 found that exposure response prevention and general cognitive behavioral therapy are about equally effective during initial treatment. And after 2 years, the participants who had done exposure and response prevention had lower obsessive compulsive symptoms than those who had just done general CBT. A study that focused on just kids and teens with obsessive compulsive disorder found that just 5 weeks of intense ERP resulted in significant improvement over waitlist controls. Additionally, this improvement was maintained for the next 14 months. Overall, a 2015 study that looked at 37 other randomized controlled trials, which are the best kinds of experiments about whether a treatment works or not, found that cognitive behavioral therapy and exposure response prevention are very effective when compared to waitlist and placebo controls. To summarize, exposure and response prevention is a particular form of CBT that is geared especially for obsessive compulsive disorder, and you should try it because it works. Thank you for watching this video, and please join me for future videos to learn more specifics about ERP.